thought. If they had had access to treatment, they would have had a chance to live. Thank you for your time.
Thank you, Melissa. Kevin?
Thank you.
No green screen behind you.
I do need that. At least I have a clock, so that feels a little more comfortable. I have handouts if somebody wants to. Thank you. Because of the time, I'll skip the formalities if you don't mind. Senators, representatives, and members of all the committees, thank you so much for allowing me to be here today. I'm Kevin Mannix from Portland, and I'm here in strong support of LR 2599. Now, I'm sure most of you recognize me from television, but if not, I've been a forecaster on WCSH and WLBZ for 26 years. Before that, forecasting in northern Maine on Channel 8. And if you're wondering, it's going to warm up tomorrow. It's pretty warm in here, actually. Yeah, it won't even be that warm tomorrow outside. I'm not here as a weatherman today, though. I've got another very important message that I'd like to share. First of all, I want to say what an honor it is to stand before you and speak about this very complex issue. I can speak from the perspective of an adult child of an alcoholic father and a mother who was deeply depressed. Neither one of my parents sought effective help, so I spent my adult life on a journey of recovery from the effects of a chaotic childhood. I'm here for two reasons. One, to talk about the importance of educating society as a whole around the issue of shame and stigma, which is still one of the biggest barriers, and you've heard this a lot today, preventing people from reaching out for help. People often feel embarrassed or ashamed to reach out, and that's why we need to re-educate society on the importance of compassion and acceptance. It has to become okay to struggle at times and reach out without shame. A person has to feel worthy of help, and society needs to be there to help them. A second reason I'm here today is to share with you some of the powerful comments I received after Kevin's story aired in September 2013. I shared my struggle of growing up in a dysfunctional home and the lingering effects into my adult life with my viewers. Now, I still struggle with some anxiety and depression, and I've had to learn how to quell that voice in my head that says, I am not worthy to be standing, for instance, in front of you today. It was one of the many messages that was instilled in me at a very young age. What I have learned through education and help is to replace that message of not feeling worthy with a message that says, I do count. I hope I don't see headlines tomorrow that say Kevin Mannix hears voices and talks to them, but so be it if that's the case. My point is that the sooner people get help, the help they need, if willing, the less they hurt themselves and those around them. After Kevin's story aired, we got thousands of responses thanking us for talking about the dark subject of shame and for encouraging people to share their story with someone. I want to take just a second and read a couple of very powerful responses. Quote, a coworker who felt she had nothing to live for was motivated to seek therapy because of watching and listening to Kevin's story. Close quote. Quote, thank you for opening a door, breaking the silence. Stigma about any problem needs to be erased. Close quote. And quote, thanks for talking about shame. It's very important for people growing up with the secrets of a dysfunctional childhood and the lingering effects it has into adulthood. As some of you may know, my wife and I also wrote a book last year called Weathering Shame, and we're very proud of it. That's it. It's all about shame and stigma and our individual journeys towards wellness, as well as our hope for a more compassionate society. Linda, my wife, a co-writer of the book, and a social worker for 30 years, couldn't be here today because she had important clients she needed to see. But I wanted to share one thing she wrote in the book around her passion for writing it. If shame and stigma in our society keeps us from sharing our truth, then we learn to move around it. We never really embrace it and learn to weave it into our lives. Our truth gets buried. The core of who we are and what we experienced gets buried as well. We're disconnected from ourselves in many ways. Why are certain subjects, such as mental illness, so hard to talk about? Why are certain illnesses acceptable and others not? And who gets to decide that? Can we change this idea so that people can live freely? Again, I'm here to strongly promote the passage of LR 2599, and I encourage each and every one of you to put as much of the money as possible into prevention, treatment, and recovery. Let me close with one more statement from a viewer that sums up why. Quote, Kevin, "You have done a great service to thousands of Mainers by normalizing these issues. As a society, we need to become more aware of mental health issues and promote the benefits of accessing professional help." Thank you for your time, and I'm hopeful and happy to answer any questions that you may have.
Thank you. Questions? You around? Nope, seeing none.
Thank you.
Thank you. Thomas Connolly? And after that, we've got Moran, Curtis, Chambers, and Olson, I think. And that would be the first page.
I brought gifts. And 4 minutes and 30 seconds.
Run.
Okay. Honorable chairpersons and members of the committee. My name is Thomas Connolly, and I serve as the Chief of Police of the City of Sanford. I'm here today to support and comment upon LR 2599, which is a modest first step in the essential work of combating the damage that substance abuse is doing in our communities. I also want to touch on the additional steps that are necessary to address this crisis, especially with regard to heroin and opiate addiction. Specifically, I would like to emphasize my opinion that spending precious state funds on treatment for opiate addiction be limited to evidence-based and medication-assisted programs. When users demand an illegal drug, someone will always provide a supply. Law enforcement agencies of the United States have been attempting unsuccessfully to interdict the supply of drugs into this country for over 40 years. I believe it's safe to say that we have been unsuccessful in stopping the supply of drugs. And while enforcement remains an effective strategy to address substance abuse, it's only one element of a three-part strategy that must be implemented, and that is enforcement, treatment, and prevention and education. Now, I bring extensive experience in education to this issue. I've been the Chief of Police for Sanford, Maine since 2007, and I spent 25 years prior to that as a member of the Prince George's County, Maryland Police Department. I retired at the rank of major, and during my tenure there, I was the commander of the Narcotics Enforcement Division, which had about 150 people assigned to it at the time. I have a master's degree in psychology, which informs my understanding of the effective prevention and treatment of addiction. In an attempt to educate the Sanford community about the current heroin epidemic, I authored and published a comprehensive 35-page booklet entitled Heroin, What You Need to Know and Why. And I published it with grant funds, and I had 200 copies, and I'm down to my last 25, so it's getting out there little by little. I applaud the legislature's desire to fund treatment programs in the community. However, it is my belief that most of the money that's been identified for treatment in LR 2599 will be spent on treatment that is not effective for opiate addiction. Evidence-based treatment for opiate addiction is medication-assisted treatment combined with behavioral therapies such as motivational enhancement therapy, cognitive behavioral training, contingency management, and community reinforcement. These therapies are delivered through an intensive outpatient program followed by group and individual counseling and random drug testing. Because long-term opiate addiction actually changes the structure and function of the brain, such evidence-based treatment may require several years of continuing treatment. And I understand that that's an issue for many people when we talk about drug treatment, about how many years and years and years. But to get off script a tad, what I would suggest is that if I was an opiate addict and I got into a methadone program, and if I was able to work, have a job, pay taxes, raise a family, but every day I had to take methadone, well, then I would ask, what is the problem? You know, it's an inexpensive drug, but it does miraculous things for people who want not to use illegal opiates and who can get into the program and who can stay with the program. It is extremely important to remember that MAT, medicated assisted treatment, is not a substitution for illegal drugs. We are not substituting one addiction for another. This is a medication for a disease, and everybody understands now, I think, that addiction is a disease, no different than diabetes, and that it may require years and years of treatment, but there is some light at the end of the tunnel. MAT allows patients to find and maintain a job, to avoid criminal acts, to reduce their exposure to HIV and hepatitis C by eliminating IV drug injections. MAT allows a patient to participate in required counseling and makes changes in their lives that are paramount to an essential recovery. On the other hand, detoxification is not a preferred treatment for opiate addiction. Rather, induction into methadone or buprenorphine replacement is evidence-based and may be done on an outpatient basis. If inpatient care is required, it usually is a day, 2 days at the most. Detoxification suggests abstinence, and abstinence-based treatment for opiate addiction has a very high failure rate. Some people say as high as 90%. Now, the city of Sanford, Maine, and the Sanford Police Department and Maine Behavioral Health are currently in the final phase, hopefully, of a development of a community-based opiate addiction treatment program that will be evidence-based. And there's a copy of the very brief MOU that I submitted to Maine Behavioral Health for their review and hopefully their signature, which just identifies the major issues involved. This program was developed in conjunction with the efforts of the Mayor's Coalition and is supported by LD 1488, the lead of the Law Enforcement Assisted Diversion Bill. This is what I would consider to be a true law enforcement assisted diversion, since law enforcement officers will be trained to identify in the community people who would be good candidates for treatment, referred to an evidence-based program, and hopefully monitor and maintain long-term in that program. In closing, thank you for allowing me the opportunity to address the committee. It is my honor to represent the men and women of the Sanford Police Department and the citizens of the city of Sanford, and I would be pleased to answer any questions that you might have.
Thank you, Chief.
Thank you.
Questions, anyone? I do want a copy of your book. I've spent far too much time in 2015 on heroin.
Well, it's written for, it's not a scholarly work. It's written as to be understood by the average reader, and I think it answers a lot of questions. So I brought 15 copies, so I'll just leave them in. No, but thank you very much for the time.
Thank you, Chief. Yes.
Is that true? You had all the trouble with heroin?
Yes, spent too much time on heroin in 2015. Dan Moore. Come on up.
Good afternoon, Senator Emmer, Representative Rotundo, Senator Teen, and Senator Brady, if you were here, members of the joint committees. My name is Dan Morin. I'm Director of Government Affairs for Maine Health, and thank you for allowing me to speak here today. You heard a while back from Program Manager for the TIP program from Maine Behavioral Healthcare. Maine Behavioral Healthcare is a member of Maine Health. I want to start by saying we're in support of the proposal before you. I'm by far not an expert on the issue. You're hearing from them now, but we wanted to add a few comments on the issue and also start by offering our clinical expertise from the many providers at Maine Health and all the members we have, including what you've heard from today. We'd be glad to get more information back to you about the situations we're dealing with and the problems we're facing. This bill is the first step to addressing opioid dependence and addiction that our providers see every day. You've heard some statistics. Ours are between 2006 and 2013. We've seen drug-affected infants rise from 201 a year to 927 a year. Last year, it was at 995. Our providers are also challenged daily with addiction so severe that that behavior compromises their other medical care as a result, causing extended problems with their overall well-being. Addressing this problem is complex, it's multifaceted, it must have prevention measures, treatment measures, and law enforcement resources. As some of you well know, Mercy closed their recovery center last fall, and as a result, we're seeing a large number of patients with few, if any, options to treat their addiction. addiction problems. We're concerned that the bill limits the detox beds to the Bangor area. We're sure it's needed, we're sure they welcome them, but there are also beds needed in southern Maine and other areas of Maine. We'd like to see that addressed in the bill. And also, without treatment options such as medication-assisted therapy, as you heard from Chief right before me, we won't be offering patients and providers all the tools necessary to combat this problem. As an important note, as a large and integrated healthcare system, we're taking steps as well to work on this problem along with you. Our largest physician practice, Maine Medical Partners, is partnering with Maine Behavioral Healthcare on pilot programs to increase treatment options for opioid dependence in primary care offices and help better educate those primary care physicians that are often ill-equipped to deal with that, among the other things they deal with. We're also having internal discussions to ensure best prescribing practices across the system to address some of the concerns you've heard about opioid prescribing practices. And as you just heard, Chief Connolly, Southern Maine Healthcare, Biddeford campus and Sanford campus working closely with law enforcement in that area to come up with solutions and work together, which is what we're here today to offer you. There are no easy answers, but I'm here pretty much every day. Most of you know how to get a hold of me. We can help in any way with any information about what we're doing, what we'd like to see, what we may be able to offer to help make this legislation work and go through the process. We'd be happy to do that. You're hearing today the negative effects that this has on patients, your constituents, our communities, and the economy. And I'm glad we're getting started so early in the session on this issue. Be happy to answer any questions.
Thank you, Dan. Questions, David? Seeing none. Thank you. Nikki Curtis?
Good afternoon. Thank you for having me here. I'd like to thank everybody who spoke before me. I am here to testify on the behalf of the Portland Recovery Community Center, as it was a piece of my own recovery. I'm a woman in long-term recovery, and my sobriety date is July 18, 2012. I came into recovery when I was 40 years old, as a later in life adult, I'd like to say. And I came through a program. I'm actually somebody who came through on a scholarship bed through treatment because I did not have Maine care, nor did I qualify for it at the time for treatment. I came through on a scholarship bed into treatment, and partway through my program, I actually broke a rule and was discharged. And I knew of no other place to go other than the Portland Recovery Community Center, where I had been introduced through my treatment center as a place for support and meetings and a place to invest in my own recovery. And when I came to the recovery center that day, when I didn't know what else to do, I was in Portland, Maine. I'm from Presque Isle, where there aren't a lot of options for treatment. I came down and I didn't know where to go, and I didn't know what to do, and I didn't want to end up at the shelter, and I didn't want to end up back in a position where I would end up using drugs as an alternative or a backup. So I went there, and they supported me in my recovery. And benefits that I've gotten since going there, I was able to look for work from there. I was able to find a place to live from the resources that they were able to give me. I had love and support and encouragement to better my life and to become a person that I had come into treatment in order to become. They continued that support for me, and they reassured me that I could do the next right thing and that I didn't have to go back to acting in my addiction. So I am very grateful for that opportunity and that support that I received from the Recovery Center. They absolutely saved my life. I currently work there now. I have been an employee of the Recovery Center for the last 2 years, and I am grateful for the opportunity to pass that forward and pay that forward to other people who are in recovery coming in and looking for the same kinds of support. I have a lot of experience in the area that I'm able to share with them and encourage them and know that they can do it as well. We all deserve a chance to make better choices, and sometimes, like for myself, when I don't know what those better choices what they are sometimes, I'm able to refer to people in a community who will support me to make those choices because I want to. So I'm very grateful to be here. I'm going to keep it really short, but the Recovery Center is a huge part of my life. If I had had access to one of those in Aroostook County, where I'm from, and had known and had knowledge of that, I think I would have had an opportunity sooner in my life to make these better choices and to be the person that I am today. So thank you for letting me testify, and I'm really, really grateful to be here.
Thank you, Nikki. Thanks for sharing your story. Corey Ann Chambers?
Hello, thank you for giving me a chance to speak today. My name is Corey Ann Chambers. I'm an addict in recovery, and I'm here to speak about the PRCC as well, the Portland Recovery Community Center. For the better part of a year, I've been in recovery, and Portland Recovery Community Center has helped me tremendously through this process. The fellowship there, the members, the volunteers, and the staff have all been a huge support in my recovery. I've had some ups and downs, especially this summer, where like finding sober living and such were like difficult for me, and the staff and the volunteers there were really supportive. There's really great meetings there throughout the week. I actually started a meeting there, an AA meeting, that has been like really, really exciting for me about 4 months ago, where you know, it's gotten to be big, where like there's like up to 40 people there, and we're all seeking the same thing, recovery and finding a new way to live. Everyone that comes there, we're all fighting this battle of addiction, and we're all looking to do the right thing one day at a time. You know, like I said, I've been coming to the PRCC for the better part of a year, and it's just been a really great opportunity to get to know the staff and other members, where I found friends who I love and support me, and I support them, and helping each other in this process. And it's just been a really great experience to be part of it. Thank you.
Thank you. Questions, anyone? Very good. Thank you again. Steve Olson?
Good afternoon.
Good afternoon.
I'm here to represent PRC also. About a year ago, I got into some legal trouble also. Doing drugs and whatnot. I went to jail. I bailed myself out. I got out, and I didn't really know about the recovery center, this PRC place. So I went back out and continued using. I didn't know about recovery. I wasn't really interested at the time. And I ended up overdosing. And through the grace of God and Narcan, I'm still here. I went back to jail. I got out and started going to the PRC. And at first, I really didn't trust anybody. I mean, as an addict, you don't trust yourself, so you really can't trust anybody else. And but I kept going back, and it gave me. After a while, I started seeing that there were people that understood me and understood where I was coming from and were there to help me. And as of December 14th, I finally got a year clean with the help of everybody there, and my recovery family. It feels like a family to me. Like people that can share your story and know what you've been through. And when I go there every day. I hang out almost every day there. My spare time, I hang out there because it's a good feeling to know that at a year now, somebody new can come in and look at me, and I can give them what somebody gave me a year ago, and it feels good that somebody can look at me. I definitely appreciate programs like that. Without it, I really don't know where I would be, and a lot of people I know, I don't know where we would be without stuff like that. So,
Steve, are you employed now?
yes, sir.
You are.
Good, sir.
And incarcerated for trafficking?
Yes, sir.
Just trying to get a feel all the way around.
Okay.
Yeah. Good. Thank you.
Thank you.
Pastor Bobby? Last name was?
Bledsoe.
It is- okay.
Yes.
I didn't know if there's football.
Soon to be
game or
Brady,
not,
no.
you know.
I'm an Eagles fan, and so we're out of the playoffs, so I'm rooting for the Patriots now. So, but yeah. Well, I wanted to talk to you about the recovery program that we have currently in Bangor, which is free entry, which takes no taxpayer dollars to run, and people can enter without insurance. It's all been faith-based and donation-based to keep it running. The first 9 months, when a man or woman comes in our program, they're mentored, they learn a trade, then they enroll in secondary school as they're graduating. We see a complete change in people's lives. Not just putting a Band-Aid on an addict, but actually helping someone to become something different. And one of our big things we teach our men and women is we tell them to tell themselves they're not addicts anymore. Because I believe that a man or woman thinks that's what they are. So we teach them and tell them, you're not an addict anymore, you've overcome it. And you'd be surprised how many people have walked into that new life because they begin to think of themselves as something they never thought of themselves as. And after their 9 months in their first program, after the first phase, they go into a second phase, that's 4 months, where they get a job, they get employment, they're in school, and they begin to be a productive part of society, paying bills, paying their taxes, and giving back to the community. And we have seen such a tremendous turnaround. And in Bangor, Maine, we have a facility that we're buying right now. It's a $1.7 million building. It's the former YMCA building, smack right in the center of town, one of the most drug-infested areas of the whole city. And we rented it for 1 year. The landlord approached us and asked us to buy it because we've outgrown his need for it. We had a donor give us $300,000 2 weeks ago. We are in the beginning stages of raising another $1.4 million. And we foresee we currently, like I said, have 26 men and women in rented houses. And we are currently believing to have a 50-bed, 9-month recovery program for men, 50 beds for women. And we would like to be the location for the 10-bed detox center for Bangor, Maine, to be the bridge to the community, and then not only get them into detox for 3 days, but then spend the next 9 to 15 months helping them become respectable men and women in our community. And we've done all this with no finances from the government, the state, the city, it's all from faith. But as they begin to, and by the way, our website is cityreachbangor.com. If you get a chance to look at it, cityreachbangor.com, and also networkofhope.org is our 2 websites. And our vision is we're going to bring all the rented houses and bring them into one place, and we're going to call it the Hope Center, where men and women will learn trades, basically be transformed. And as the bill is passed, we would really ask to be considered in Bangor as a grant is offered for a place to be able to finish the endeavor we've been doing. And you're going to hear testimony from 7 men and women. I always say this, the proof is in the pudding. It's not what we are going to do, it's what results have been done, and let me see them. And you're going to hear testimony of 7 of the 26 people that are currently in our program who have graduated and are doing something with their lives.
So would I assume that's the next 7?
I think so, unless they get, skipped, I think so.
Well, I assume they signed up after.
They did.
Yeah, so, questions, anybody? Seeing none? Thank you. Michael, is it Kasia?
Kayak.
Kayak?
Yeah, it's Italian, so it's kind of.
Well, yeah, I was trying to.
Yeah, it's a little different.
Yeah, okay.
Yeah, but hey, I just want to say thank you guys for even coming together and trying to get a solution to the problem here. It is wonderful, and I just want to say thank you guys on my behalf for coming out and doing this. As a young man, I was exposed to a lot of wrong things when I was younger, and in a broken family, and just like most of us here, we came from a background like that. But when I was 13 years old, my sister overdosed of heroin, and right then and there, I always told myself I'll never shoot dope, I'll never do drugs. But little did I know, 2 years down the road, I was also shooting heroin myself. And that led me down a downward spiral in life. And I just want to say, if it's not for recovery programs, if it's not for, us getting together as a community and being able to have these places for men and women to come in and actually find freedom and be able to say, I was once an addict, but now I'm not because of places like City Reach, places like Wellsprings and things that we have in Bangor. And I just really hope that, we're able to come together and find a solution to this problem, because the drug epidemic, it is bad. And it's not going to get any better unless we do something, or we stand up and we do something about it. So I just, I'm just a mere man here today, but if I can, just say that I just want to thank you guys for coming out. And if it wasn't for places like City Reach, places that I didn't have insurance at the time when I was an addict, I didn't have no way out. But, places like that opened me with open arms, and it was in an environment, a loving environment is what changes it. And that's what City Reach established, was a loving environment, really compassionate, and was able to help me through that. I have so much hope now for my future. I've been clean over 2 years. I just recently got married, and, my whole life has been restored to me because of places like City Reach Bangor. And I just want to say thank you guys for letting me share this afternoon, and I hope we can come up with a solution to this problem.
Thank you, Michael.
Yes.
Questions? Anyone?
Thanks.
Thank you again. Mel, I cannot read your last name.
McWhorter.
It's what again?
McWhorter. My name is Mel McWhorter, and on behalf of City Reach, thank you for allowing us to speak today. My story starts in Clinton, North Carolina. It's a small rural town on the East Coast. I grew up what I thought was a normal environment. My dad was a highly functional alcoholic, and he was a crack addict. And, that was acceptable for me. I didn't want to be around it, so a way out, I was able to come up here to go to school through my athleticism and through my academics. Being caged up like that in a home, and I was kind of like antisocial anyway. When I had the opportunity to get loose like that, I got loose, and I just ran with it, and I found myself homeless, alcoholic, living on the streets of Bangor. I was a very disturbed young man, and I just really didn't know how to change. I tried seminars, I tried AA, I tried NA. None of that did work for me, but this program worked for me, and that's all I know that worked for me. And it's just changed my life. I'm right now running a home in Ellsworth, Maine. That's something I thought I'd never do. I'm like giving back. I just love giving back, and I'll say yes on this bill. Any questions?
Seeing none. Thank you. You've been patient. Stefan, and I won't attempt the last name.
Hi, I'm Stefan Drozmicki. I'm 25. Okay, 6 years ago, I was introduced to opiate painkillers. Once I became addicted, I went down the wrong road. That road led me to the path of crime. That crime made me a suspect in an armed robbery, including an addiction. In 2012, I was convicted and spent 2 years in county jail. There, I was rehabilitated with my criminal thinking, but never got the treatment for my addiction. I continued using once I was out. I've been to methadone and Suboxone clinics, so substitutions do not work for recovery in my life, and nor do I think they're going to work for anyone else's life. The substitutions led me to meet the people who were into other drugs such as heroin. Once I became addicted to that, and I almost lost my life. I mean, I've overdosed 3 times. The last time I just overdosed in June 29th, 2015. After that, I wanted the treatment, but I couldn't afford it. So I was searching, and I pretty much figured out without insurance, $500 a day is pretty much the average for a rehab. So 30-day rehab, you're going to be spending about $15,000, and to me, that's a lot of money. I'm not sure about everyone else, but to me, that's a lot. And 30 days also, I don't think is enough to get your life right and recover for your entire life. So I found a 9-month program, and it was called City Reach in Bangor. The reason I was able to go to that is because it was free. And I mean, who gives someone a chance to change their life for free? That would be someone that actually cares about the well-being of a human, And to me, that meant a lot, because being an addict, not many people have that. So to see someone that actually cared and wanted to be there, and help you change your life. That just meant a lot. So to this day, I'm a little over 6 months clean and sober, and I mean, I haven't felt this good since I started using. So I mean, I support the bill, and I hope to expand city reach and, you know, help change other hurt people's lives. Thanks.
Stefan, when I heard you speaking, I couldn't help but think of the expression, you don't take heroin, heroin takes you. And that's what I heard from you, was it took you.
Yes.
Yeah.
Any questions?
Doesn't look like it. Thank you.
You're welcome.
Bruce Butler?
My name is Bruce Butler Jr., and I'm from Pittsburgh, Pennsylvania. I began using drugs at the age of 12, and by 13 I was already in my first drug rehab. I continued using drugs to find acceptance in my life, but my lifestyle constantly landed me in trouble. At 15, I was on my way to another drug rehab, and by 16, I was in a juvenile detention center with multiple felony charges. In that same year, I had also been expelled from school while suffering an injury that required surgery. Struggling with addiction, my dependency for prescription pills worsened. Still dealing with the juvenile court system, I was using whenever possible, resulting in me failing my required drug screenings, and by 17, I was in my third drug rehab. I still didn't learn my lesson. I continued to use drugs, and by 19, I was fully dependent on heroin and had to inject myself multiple times a day. I had also started recreationally smoking crack cocaine, and by 22, I was on my way to yet another drug rehab. Not even 24 hours after being released from rehab, I was injecting heroin again and was quickly fully dependent on the drug. I personally seen multiple people die and have suffered the pain of addiction in ways I cannot describe. Then I heard a sign of hope. Someone began to tell me of a man that had left the city and was enjoying the life in ways I've never heard of after experiencing